All right. So we're going to start with the live quiz and we're going to start ASAP so that we can have time to listen to our colleagues' presentation, ask them questions, and somebody's already joining. That was fast. And also contribute to the discussion today. So please do scan the QR code on your screen, or you can go to www.kaut.it so you can join the live quiz. We don't have a lot of questions. We have about 20 questions, and we have a prize for the winner. So please do join and let us have our final assessment for the fellowship. We trust that you're all experts, so I'm looking forward for this to be very competitive actually. So please join. We want to see all fellows on the screen. And we have about 8 of you on the call, about 7 of you on the call. So please do join. We need all of you.
We are waiting for 2 people to join so that we can start. Actually, 3. Bamidele has also joined. 6, 7, 8. There are 8, so we are waiting for about 3 people to join.
Yeah, and I've dropped a reminder on the page now so we can have more people join us. So just wait. So we have 6 people on the screen and we need to have, I think, 7 actually. So we're waiting for one more person. So let us know if you're having any internet issues or you have any challenges joining. So you can quickly scan the QR code. I think that's faster to join.
Two more people. I'm seeing we have a body has also joined, so we need 2 more people to join so that we can start.
Okay. All right. Yes, we can see if you've joined actually. I think Kofi is asking on the group page if we can see if he has joined. So you can use your name so that we know who is on the screen. All right. Okay. Can we start now, Bridget?
Okay.
All right.
So we are 8. Let's start. And speed is very important. Our first question, which of the following is listed as a pillar of effective M&E in digital health? Great. All of us have passed that. So 27 is leading. Let's go to the next. In the digital health results chain, which results level captures users trained, facilities onboarded, reports submitted? outputs, and majority of us have got that. So let's see who is still taking the lead. 27 followed by ABC. Well done. Let's go on to the next. In defining SMART objectives for digital health, what does the A represent according to the session? Yeah, so this one was tricky. It was tricky. So 4 of us have got it right. 27 has gone down. ABC is taking the lead now. The example, an electronic immunization registry will increase coverage. Best illustrates which pathway? An electronic immunization registry will increase coverage. Yes, so majority of us have got this as well, and ABC is still taking the lead. So let's move to the next. Which of the following targets is SMART? Thank you. All of us have got this, and ABC is still the lead. Let's move on. Which of the following is listed as a common mistake in setting targets? Great. All of us have got this. Let's move on. ABC is still taking the lead. Let's move on to the next. Which of the following is listed as a stage of digital health intervention maturity? If you've just joined, you can see the pin up there. You just enter your browser, kahoot.it, or you scan that small QR code. Yes, so this one was also tricky. I can see only 4 of us out of 8 have got it, but it's a good, at least majority of us have gotten it. So let's move on. ABC has gone down. Fire is now taking lead. Let's move on. Let's move to the next. If you've just joined, the QR code is at the extreme corner, extreme left corner. So you can scan it. Which of the following is commonly included in a digital health M&E work plan structure? Great. So this was pretty easy. Let's move on. 10 is getting there. Which of the following elements is explicitly listed as part of the digital health M&E work plan structure? Explicitly listed. Great. Let's move on. Temi is still taking the lead. What does the term monitoring burden encompass? What does the term monitoring burden encompass? Great. So majority of us have it right. And 27 is back on the lead. Let's move on. Which of the following is an example of qualitative data? Qualitative data. Great. Let's move on. 27 still taking the lead. What is emphasized as a key closing takeaway regarding DQA design? Great. 27 still taking the lead. What is a recommended action when a DQA identifies weaknesses? Great. Majority of us have it right. And Temi is still coming up for 27. Which four-part cycle is highlighted in session 10 as central to digital health evaluation? Four-part cycle. Great. Majority of us have it correct. 27 is still taking on. At the pilot maturity stage, what is identified as the most defensible claim? At the pilot maturity stage. Wow, wow, wow. So let me not assume that this was guesswork. Only one person has gotten it. So, pilot maturity stage claims early performance is promising because that is the time you're testing out your implementation. All right. So let's move. And yeah, 27 is still taking the lead. Which of the following is listed as a step in the evaluation execution plan in session 11? Which one is a step in the evaluation execution plan? Great. So this and is back now. Restrictions to go according to section 12 dashboard primarily do. Primarily do. Great. Temi is still taking the lead. Let's move on. Two questions to go. Which of the following is listed as a common mistake in data visualization? Common mistake in data visualization. Great. So most of us have that correct. And Temi is still taking us. The second last question, according to session 13's takeaway, how is sustainable digital health capacity best built? Great. So this was very clear. Temi is still taking us. And finally, which type of analysis is used to monitor changes over time, such as the monthly system usage? Great. So well done, and thank you everyone for participating. We wait on. So this is our and we have numbers as I didn't see. Number one, Temi. Congratulations, Temi. Congratulations, and Devi. And the rest of us, thank you for your active participation in this quiz. It clearly we all learned, and we are not walking away the same way we came into the training. So it's clear that there was a lot of learning throughout this, probably, were they 8 or 12 weeks? Yeah, there's been some gains along the way. Otherwise, back to you, Vivian, for the next session.
Thank you. Thank you so much. Thank you, Bridget. And congratulations to Timmy. Can we know who ABC is? Who is ABC and who is Davy? If you can unmute and so that we can take note of your names.
This we know Temi. We know Temi is Temi Tayo.
Yes, yes, Davy.
Yeah, David Stephen Lungo.
Oh, Steven. Nice, nice. Okay. So we have gifts for
and Shola is ABC.
Oh, Shola. Okay, okay. So we
Yeah.
have Timmy, we have Steven. Which of the Steven? I know there are two Steven. Is it the P or the V?
The P.
The
PH.
P. Oh, okay. Steven, then we have Shola. I don't know if we count Shola as a winner because you are part of the team. But anyways, thank you so much for being a part of this. We would get in touch with you with your packages. So for the first place, you receive your certificate of excellence. You receive a free seat in any of our upcoming boot camps. You receive 1 year complimentary access to all of DHA's events, webinars, conferences. Also recommendation letter upon request. Also a one-on-one mentorship session with any of our facilitator, and also a priority scholarship consideration for any programs that we have. Thank you so much for participating. Thank you, Timmy, and congratulations. So up next, we'll be going to the presentation. We have two presentations today from our colleagues. That's Stephen and Bamidele, if I'm correct. Yeah, so Stephen and Bamidele, please, Stephen, do share your screen. If you're ready, let's have you first. Please, you have 5 minutes for your presentation, and every other person can contribute, ask you questions, challenge your approach, and also our facilitators will give feedback. So, Stephen, over to you, though I can't see him on the call. So, Bamidele, I think you can go ahead with your presentation.
I'm on the call.
Oh, okay. Oh, yeah. So please share your screen. Let me give you host access. So please, let's make it snappy. We have just 30 minutes to go, so we can stick to today's timing. Are you able to share now? You have the access to share.
Yes, I can share now.
Okay.
Are you able to see my screen?
Yeah.
Okay, all right. So I wasn't quite very sure about the format of the presentation, but then I read in the chat that I can still present the Word document. So if that's fine, I can proceed.
Yeah.
Okay. So the project that I picked was tied to the work that I do. So I'm more of a digital health implementer, um, more than an M&E person. So the project I picked was developing an M&E framework for the digital commodity and stock management system in school health rooms. So I'll go right away into the foundations. So the challenges that we have identified currently is that the system of managing stocks and commodities in health rooms is mostly paper-based, and in a few months back, it was digitized using COBOL forms. Yeah, but then the adoption was quite bad, and the system didn't really quite scale. So health rooms resorted to paper-based systems as it was initially. So the challenges have been school health rooms have been experiencing terrible medical deliveries, stock levels. We do not have visibility in stock levels. Stock consumption has been difficult to predict, as well as there's been an increased rate of stockouts. And then, like, people responsible would only be informed later on because they do not have visibility on stockouts and consumption. So those are the challenges that were identified, and we embarked on developing, implementing a digital platform that will help to have visibility in this and commodity management. So that is managing delivery nodes and monthly stock take activities as well. Then from there, data go into the central data warehouse, and then after it's cleaned, it will be visualized in dashboards. So that's the process. Then here, we have the major key stakeholders that we identified. We have the health room staff. So these are the downstream implementers at the school health room. Then we have program managers. So these oversee the program. And we have the M&E staff responsible for monitoring and evaluation and some data analysis as well. Then we have teams from the supply chain and logistics, ensuring that commodities are safely stored at the warehouse and then distributed to the various districts and health rooms as well. Then we have the digital team, which is the implementer of the platform. Then we have the school going learners who are the actual beneficiaries. Then down here, we have other partners, donors, and regulators as well. Then the platform, which is a technology partner, is Comcare. So that's the platform that was selected after evaluation that we could use to automate the stocks and commodity workflow. So M&E is very important for this project because it will help to provide us with some structure in assessing whether the platform that we're implementing or the intervention is being implemented according to the objectives that are desired. And then it will help us also to keep track of system utilization, reporting compliance, data quality, stock available, and basically overall program and commodity management process. So that is why an M&E framework is very important to this particular intervention. Okay, then I can quickly move to the logic models and the theory of change. So here I mapped out the results chain. So we have inputs, activities, outputs, and outcomes and impact. So I received some good feedback from mentor Justice. I thank you for the comments. So I made the changes from the initial discussion that we had. So under inputs, here I have Comcare platform, which is a technology partner that we're using. Then we have mobile devices. So these are phones and tablets that will be loaded with the Comcare app and then given to teachers in the health rooms. Then we have the commodity catalog. So this will come from the supply chain and the warehouse team. They have internet connectivity, M&D support, and the support from the personnel from supply chain. Then in activity, Comcare to ensure that it matches with the approved workflow for commodity tracking and stock management. So we have the major two forms, the delivery notes and the monthly stock take forms that will be deployed in the health rooms. Another activity that will be done will be training health room staff on how to use the platform, provide much needed support, mentorship, and also conduct data quality review meetings on a monthly basis. Then on outputs, we're looking at having the system or platform deployed in the participating health rooms. ensuring that digital delivery notes and the monthly stock take forms are configured. So that's another output in this implementation. Then also looking at training of health room staff and personnel, also ensuring that the system performs according to the desired tasks and objectives, documenting and collecting feedback from health rooms, system usage and adoption monitoring. And then the outcomes that were identified, or the outcomes are, we want to see improved reporting compliance from these schools. Yeah, we also want to see improved inventory management accuracy, increased visibility in stock levels at school level, at district, provincial, and at central warehouse. We want to ensure that there's reduced stockouts being noted, improved data quality, and more time reporting from health rooms. What the impact is, I want to see improved availability of these essential commodities and drugs in school health rooms, leading to improved healthcare delivery to the learners. So this is our results chain for this project. Now the model that I settled for this particular project was the theory of change. And this is because I want to understand what is involved in bringing up this change. Yeah, what the introduction of the digital commodity and stock management system is likely to bring some improvement in the workflow of the inventory management and commodity. So that is the logic model that I settled for, the theory of change. Then the most important outcome that should be measured in this project is simply improved availability of these essential in school health rooms. And then it's important because it's a core principle of this project. We want to ensure that learners that visit health rooms are treated and receive timely care. And so if a learner goes to a health room and they find that they don't have drugs there, what's the point of having it there when they're not receiving what they need? So it's very important to ensure that health rooms never run out of essential commodities, because that's the reason why they're there. So I'll quickly move to results indicators and metrics. So I identified 5 smart indicators that we want to track in this implementation. So this matrix I created displays the indicator, what it measures, why it matters, and the data collection method. So here, the first one, and this one is the health room coverage rate. So this one will look at the percentage of target health rooms equipped with the digital commodity management system. Yeah, so why this matters is it measures the extent to which the system is deployed and implemented. So the data collection method will be through CommCare using the logs. When the health room is onboarded, we have records that keep track of that, as well as CommCare system configuration reports. So those will be methods that we use to collect data for the health room coverage. Then the second one is measuring the monthly stock take reporting rate. So we want to see the percentage of expected monthly stock take reports rather, submitted by the participating health room during the particular month. So this is important because it helps us measure the adoption and reporting compliance by the participating health rooms. So again, this one, data will be collected through the CommCare monthly stock take form that is being developed, as well as submission and reporting logs that we get from the platform. Then the third indicator is the delivery note digitization rate. So this one, we're looking at the percentage of digital commodity deliveries that are recorded using the platform during the reporting period. Now, this is important because it helps us to see the utilization of the digital stock management system, and more specifically, the delivery note. So this one, again, will be collected through the delivery notes that are submitted every time a school health room receives drugs from either the organization or the implementing partner. Then the fourth one is the stockouts rate. So we're looking at the percentage of commodities experiencing at least one stockout during the reporting month. Yeah, so this one measures the availability of commodities and also helps to inform supply chain decisions. So data will be collected from the monthly stock takes that are conducted at the end of the month. Then the report completeness rate. So this one is used to inform the percentage of submitted stock management reports that are containing all mandatory fields. So we're looking at data completeness. So if a field is required, was it submitted? Is it there? Can we see it in the data? So this one will help us measure the quality of data that is submitted, both in the monthly stock take form and the delivery note. Yeah. Okay. So now, because of time, is there maybe a particular point or part of this presentation you'd quickly want me to jump to? Because I don't think I can, going step by step, I can manage to do that in 5 minutes.
Thank you, Stephen. I don't know if you managed to do something with did you plan how monitoring would be done? 4 main things: monitoring, evaluation, and reporting or capacity building. If you can quickly show us any of those 4, because those are the most important things when it comes to M&E. And capacity building should also contain sustainability of that tool.
Yeah. Okay. Let me quickly jump to that then. So I created a work plan. So it includes the activities that are desired to be conducted, the person responsible, the timeline, and the resources that are needed. So each one is assigned an activity, and we know clearly who's responsible. The timeline and the specified resources are indicated. So let me move to evaluation. Okay. Okay, yeah. So monitoring. So the focus areas for monitoring the project will be these listed here. So we want to see digital commodity management, data collection, performance monitoring and reporting, and data management and integration. So with digital commodity management collection, the collection tool, the monitoring tool we're using is Comcare. Now the justification is this one is a resource that is very which fits very well in low income settings. So it's a offline first platform, and it can be used to capture delivery notes. It will be used to capture delivery notes, monthly stock take, and the inventory updates. So data will be entered offline and then synced at the end of the week to the servers. So making it a tool that fits our environment really well. Then for performance monitoring and reporting, we will use Power BI service to create interactive dashboards to visualize this data, ensuring that indicators such as coverage, reporting compliance, inventory accuracy, stockout rates, and data quality are presented to inform decision making. Then for data management and integration, like I said earlier, Comcare is an offline first. So once data is entered offline, it will be synced at the end of the week. And then once it's synced, it goes to the servers. And then from the servers, Comcare servers, it comes to our central data warehouse. So we create like data pipelines that pull data from Comcare servers into our central data warehouse. Then from a central data warehouse, we create a semantic model that feeds to Power BI, and then it refreshes on a daily basis. So the central data warehouse will facilitate historical analysis and any partner data integrations that are needed to maybe the Ministry of Health or the Ministry of Education. So created all the required fields indicated there. Then let me move to evaluation. All right, so the evaluation, the appropriate evaluation that was picked at this stage is process evaluation. Yeah, so since this digital implementation, this digital intervention is being implemented, and the primary objective at this point is to assess whether we're implementing it according to our planned objectives and that we're achieving the intended outputs that were put initially. Yeah, so this one is what was settled for. And then in process evaluation, we want to look at key things such as system deployment. How many health rooms are we deploying? Is it according to the targets? And are we on track? User training. Yeah, users will be using the system adequately trained. We're also looking at system adoption, reporting compliance, and user experience. Yeah, so that is what was designed. And then let me move to the design. Okay. So on the evaluation sampling technology that was used, it's a mixed sampling strategy that I settled for. So a census approach will be used for quantitative routine monitoring, while an intended purposive sampling will be used for qualitative interviews and user feedback. Yeah, so for the quantitative component, so data from all school health rooms that are participating in the implementation will have to be included. And this will help us to have an overall picture of the indicators that we're trying to monitor, such as delivery note digitization, report completeness, inventory, and stock out rates. Whereas for qualitative, which will be purposeful, so this one will be based on selecting users that are directly involved in the implementation, those that are using the system, and those that are managing it. Okay, so here I have a table that shows the data collection plan, who's involved for the evaluation as well. So a health room staff, this will be a group, and that's a proposed sample size. So these will be selected from different geographical regions so that we have a holistic understanding. Then we have the program and implementation staff. So this, again, will be selected on responsibility based on their responsibilities that they play in supervising school health teachers. Supply chain, a sample size of 2 to 3. So these will be selected based on their role that they play in logistics and warehouse management of the inventory workflow. Then the M&E and digital health, again, a sample size of 3. So this is also based on the workflow digitization that they do, managing dashboards and technical support that they provide to the end users. Yeah, so that is my evaluation data collection plan. Then I'll quickly jump to analysis and visualization. So for analysis and visualization, those are the indicators and what we are measuring. And then for the dashboard plan or prototype, we'll have KPI cards on top that will display proportions such as health room coverage rates, active user rates, reporting rates, and whatnot. Then for trains, we'll use line charts to show implementation progress over time. Then for geographic performance, we use a map that is filled using a color gradient to show facilities that are performing well and those that may need really, really good support and supervision. Then for data quality, a clustered bar chart will help to assess timeliness, completeness, and consistency of data. Then to filter based on the region or a particular month, we use dashboard slicers in Power BI to create dashboard filters. Okay, then let me move to learning and capacity building. Yeah, so here on learning and capacity building, let me identify. So when it comes to learning and capacity building, sorry, let me just come here. Okay, so here, this one, we're looking at we'll look at the challenges that we anticipate and the actions. So when we look at the implementation performance dashboard, yeah, so we'll use so the targets that we have and the indicator there, and we can use sort of like this status indicator to show whether we're on track in meeting the target or not. Then the implementation challenges and risks here. So the project will use an adaptive management approach to monitor M&E findings and use these results to make decisions and improve the system. And then we also employ to use monthly dashboard reviews or quarterly performance reviews to identify implementation challenges, measure against targets, and agree on corrective actions. So just as an example, if, for example, the monthly stock take rate falls below a specific target, the M&E team will have to follow up and investigate what the cause might be. And also they might use reporting data, system logs, and feedback that they get from the health rooms. And so if based on the feedback, there is a need for additional support, such as maybe a refresher training or some really specific supportive action will be given to them. If it's connectivity or device issues, they'll have to resolve as well. So the effectiveness of these interventions would then have to be monitored over the next couple of reporting periods to see if the actions that were given have really improved the problem. So that cycle will now continue to monitor, learn, provide action, and then check if the support or action that was given really solved the issue. Then in terms of capacity building, so the plan is to provide initial support, initial training to teachers and the various stakeholders that are involved. Then after that initial training, needs to develop standard operating procedures, user guides and manuals that will help to sort of provide guidelines for users to use after the initial training is done. And then thereafter, an arrangement for weekly or monthly data meetings will be arranged so that we regularly discuss the data that's coming in from the dashboards, any challenges, and agree on actions that need to be done. Then another point is strengthening data quality practices through supportive supervision, feedback, maybe having specific data quality meetings that look at timeliness, consistency, and completeness. And then also building an internal technical capacity to ensure that CommCare platform is well maintained, data pipelines are scalable, and they're bug-free, and ensuring that dashboards can also be maintained internally without dependency on external support, which may be costly in the long run. So those are some of the ideas to build capacity internally. Then moving on to
Thank you. No, this one was just the session that you had yesterday was just to give you like knowledge on the emerging trends. It may not necessarily be part of your capstone, but maybe what you've given is comprehensive enough. So I'd like to congratulate you, Stephen, and well done. This is very, very good work, comprehensive, and you've actually put in a lot of time to do all this. I would like to congratulate you and your mentor, Justus. Well done. Just not to delay other people, I have just a few points that maybe you'll keep track of. You'll make note of them. One is I didn't see users. I will assume that by implementers you meant the people who would be using the system, but sometimes the implementers are different from the people who are going to use the system. So it would be nice to highlight the users, people who are going to use the system to report. Then the other question I had for you is, are you M&E, or what is your role on the project? M&E or IT?
So my role is, I would say IT.
Okay. No wonder I was seeing a lot of IT technical terms. Then the other thing is, for the different structures, the logic model, the result chain, etc., etc. It would be good to represent them on the table, so that you do it horizontally, horizontal, vertical. The one that comes from the right to the left, those two things confuse me, but I guess it is horizontally. So you would be able to keep track of each level. For example, inputs, you have the level input, you have the specific inputs, you have the indicators. So you'll be able to track each level horizontally to all the different items on the table. Then I liked your evaluation. It is really comprehensive, but I needed to know when the evaluation will be conducted. Is it by annually, or after 2 years, or at the end of the project? That is very important to note, and you'll have to add it in your document. So this capstone was not just for completion of this fellowship, but it is something that is going to be an input to the M&E in your project. So it will not stop here. Then I realized your SMART objectives were not objectives, the indicators. They didn't have the time. They needed to have this, whatever the indicator says, and by when. So and then I didn't see targets. That was also very important when you're working on targets. I didn't hear any mention of baseline. I'm not sure if the project was already halfway or it is just starting. So that should clearly come out. Otherwise, thank you very much. And that is my input. It is a very comprehensive product which will guide your M&E in your intervention at work. So in addition to your IT knowledge, I guess you're going to make significant contribution to M&E on your project. Over.
Great. Thank you so much, Bridget, and congratulations, Stephen, for completing that. So please incorporate the feedback that Bridget has shared. You can also still check in with Justus, who is your assigned mentor, so that when you are submitting, you can have a final version or a revised version of your project. Great. Bamidele, are you still ready to present? And also, I think you should just present the key component as Bridget mentioned. The template we shared with you was to cover the whole sessions, but you don't need to present all of that. You can just go directly to the problem, to your M&E work plan, and those key important components that needs to be shared. So over to you.
All right, thank you. Sharing my screen. Can we all see my screen? Good morning.
Yes, we can see the screen.
Okay, beautiful. Good morning, everyone. My name is Bamidele. I'm making use of a presentation slide. So I think that I would do that to go straight to the points. First and foremost, I want to thank the Digital Health Academy for putting this advanced fellowship together. It has actually been an eye-opener for me. I have been designing, developing, and implementing digital health projects and programs, but being on the part of implementation majorly, but not in monitoring and evaluation. So this has actually positioned me, Again, a real eye opener to be so to say, because I've actually seen a lot that should have been seen. We kind of run into glitches, challenges, and these have shown me that if these are being implemented from the onset internally, so to say, we would have been able to mitigate quite a number of those challenges. I want to thank my mentor, Bridget. You have been wonderful. Thank you for the reviews and the feedback. They've been a wonderful guide to me. So not to take much of our time, this is the outline that we'll cover, but I'll just try to run through the main thing. So let me go back. My project topic is monitoring and evaluation framework for strengthening TB case detection and surveillance in Nigeria, and we have a case study, an ongoing program already. That's the real-time community-based TB screening program. The system we use is a ComTB. It's a proprietary system that was built from scratch, and it's being used across Nigeria by community-based organizations as well as private healthcare facilities across the country. So we are using that as a case study. So the problem is, we have the traditional system is being paper-based and fragmented reporting. I've had that experience that whereby when it's time for monthly review meetings, people just input numbers, just to make up the review meeting and scale through. So that's why they introduced this particular screening application, and more importantly, to have improve the data quality, transparency, and all of that. And it affects, of course, the TB program managers, healthcare workers, implementing partners and donors, and of course, individuals at risk or living with tuberculosis. So these are the key stakeholders. The Federal Ministry of Health under the Nigerian TB program, the state TB programs, the local government supervisors, and of course, the users at the facilities, the CBOs and the community health workers, the lab personnel that test samples. And of course, we have implementers, which are people like us that designs and supports as a technical team, the M&E officers and the data managers, and we have the funders, which is it's a global fund funded project. And of course, the beneficiaries are the people with confirmed or presumptive TB and the at-risk communities. And why M&E matters for this particular program? Of course, I will start with without the M&E, it's poor visibility of the program performance. What we just need is, have they submitted data? Have they captured that? But we are not able to measure, the way the M&E framework would allow us to. So it allows us to, measure whether the program is achieving its screening, referral, and reporting objectives, accessing completeness, accuracy, and consistency and timeliness of data, and all of those measures. And the overall objective, of course, is to strengthen TB surveillance in Nigeria by establishing a robust monitoring, evaluation, and learning system that supports performance improvements, evidence-based decision-making, and long-term visibility. Although a digital screening application addresses data capture, but its success depends on an effective M&E framework that ensures the data quality is top-notch. This project focuses more on design an M&E system capable of measuring program performance and supporting decision making. So the results chain. Sorry. The results chain. The project uses a theory of change because it explains how program activities are expected to produce meaningful changes. Beginning with APs, program activities generate outputs, inputs to activities, then to outputs, and to measurable outcomes, and ultimately the impact, which is the reduction of TB burden and transmission in Nigeria, improved patient outcomes, strengthening the entire TB surveillance ecosystem in the country. So why the theory of change fits best? The program is a complex digital health intervention and involving multiple stakeholders, technology, workflows, and behavioral change. The theory of change, of course, explains how and why the intervention is expected to produce results, not just what the activities lead to outputs. But the primary indicator is increased case detection and notification rates. Smart indicators for the M&E framework. Indicators were developed directly from the theory of change. They include the process, the output, the outcome, and the impact indicators. Each indication measures a change rather than simply counting the activities that is being carried out. Of course, we can suggest maybe improvements, outcomes should describe the change, not just the numbers. Thanks to my mentor for mentioning these out. So targets for key M&E indicators. Every indicator, of course, requires a baseline and meaningful progress to be measured, which is because the project is at a maturity stage, it is ongoing. Existing program records will be used where available. Where baseline information is not available, literature reviews, document reviews, and baseline assessments will be conducted. Targets were developed using national standards, program experience, and feasibility. The 12-month M&E work plan, I conceived it to begin maybe January 2027, so that we have a full cycle of 1 year from January to December. The work plan aligns with monitoring activities with implementation. It covers planning, baseline assessments, within monitoring, data quality assessments, reporting, evaluation, and dissemination to stakeholders down the chain. And of course, it will ensure that M&E activities occur continuously throughout the program life cycle. The roles and responsibilities. Effective M&E depends on clearly assigned responsibilities are stated in this table. Each responsible personnel will carry out each of their responsibilities throughout the program life cycle in order to be able to effectively monitor the project. Each stakeholder has specific accountability for data collection, quality assurance, reporting, analysis, and of course, decision making. Here's the estimated budgets for the 12-month period for contingencies, reporting, M&E meetings, DQAs, the tools, the training, evaluations, data collection and monitoring, and the personnel. Data collection system. The system is a real-time digital screening application purposely built for patient-level screening. It supports offline data collection and synchronization because of the challenge of internet access across the country. The information, of course, flows into a particular system with data visualization support. It improves reporting efficiency while reducing data loss. There are data validation rules and processes that have been put in place to ensure that the data quality and accuracy is measured. To ensure data quality, there are lots of validations, like I mentioned earlier, and measures that have been put in place across board, from personal data to screening data up to the results data that are being collected, and all of these are being automated. It addresses accuracy, completeness, timeliness, and consistency. The data governance principle, of course, ownership. The Federal Ministry of Health is the owner of the data for better decision making. Data access are used, it is role-based and based on privileges, storage and protection, encrypted in clouds, and with backups. The data quality and integrity is mandated, and it is compliance with the Nigeria Data Protection Act, which, of course, my organization is a certified part of it.
Bamidele, can we rush to, okay, this is evaluation, good. So evaluation,
Yeah.
then sustainability. Yes, those two.
Yes, I'm about to conclude.
Okay, okay.
Yes, so the evaluation approach, it's a process design evaluation is being selected because the program is already being implemented. Mixed method with both quantitative and qualitative data insights to be measured. The evaluation focuses on implementation quality rather than a quantity. And evaluation plan. The evaluation combines routine program data with interviews and document reviews, as well as the data review for incoming data on the system. Purposeful sampling would ensure participation of key stakeholders. The evaluation would also assess value for money for examining efficiency, effectiveness, and generally with regards to the economy itself. Then the dashboard, the key metrics, it translates within data into actionable information. The dashboard also includes an alert for potential locations where cases can also be measured. So it presents key indicators through KPI, trend charts, maps, and traffic alerts I mentioned earlier. And the dashboard supports timely program management because that would help with the quality of the M&E framework. The report structure, it will transform the monitoring data into actionable information. Monthly reports, quarterly reports, and annual evaluations will be carried out. These are the report types: internal reports, quarterly performance, data quality assessment, and annual M&E summary and evaluation reports. Okay, I added M&E, adaptive management and learning. Within monthly data captured across the TB cascade, monthly performance reviews, and quarterly learnings with stakeholders, findings translated into specific corrective actions, refresher training, supervisions across board. Then capacity building, even beyond the project cycle, continuous training, mentorship, and supportive supervision on data collection, data use, analysis, and reporting. Standardizing the M&E tools, standard operating protocols, and reporting templates that will be developed, and institutionalizing within data review meetings to strengthen the M&E processes. Digital health, M&E systems integration, and on interoperability standards. That was for yesterday.
Yeah.
And
Yeah, so
thank you
these are
so much.
good. Yeah. Yeah, thank you very much, Bamidele. This is it would have been nice if we had another mentor on the call to give feedback, or even from colleagues, anything that they've seen in your work, because I've reviewed, so I know this work very well, and you've put in a lot of effort and time to come up with this. I'm glad you even effected the changes from the feedback that I gave you, and it was in such a short time. So well done, and thank you for the presentation. Thank you for sharing with us your project. Just that one thing I noticed is that for baseline, you only added the data source, but we don't have the actual baseline. So for the different indicators where you have baselines available, you create a column for baseline, you add it there. If it is not available, then maybe the data source will indicate that that baseline will be got following data collected from the data source that you've indicated in the column for data source.
Noted. Very well noted.
Okay. Yeah. Otherwise, thank you, and I'm so glad that you have this output from this training. And feel free to reach out even after the fellowship. Feel free to reach out for any consultations in relation to digital health M&E while you're implementing this at your workplace. So let it not stop in the presentation here, but you have to advocate and continue with that at your workplace to see that this knowledge is contributing to the organization. Thank you. Over to you, Vivian.
Yeah.
Maybe, sorry, Vivian. Maybe what we shall have to do is I'll share for the rest of the other colleagues that haven't presented. I'll share a template that will include a maximum of 12 slides, and each slide will be targeting a specific area of M&E that we've covered. We may not have to cover everything that was in the fellowship, but at least the most important, the key items to be included in anything to do with M&E will be part of the 10 slides, so that we can reduce on the time. So we shall do 10 slides and 15 minutes for each presenter, and about 3 to 5 minutes for feedback from colleagues and mentors. That will be shared. Over to you, Vivian.
Okay, thank you, Bridget. Do we have questions for them? So I think some colleagues might be wondering, maybe you have questions for the presenters, or you have maybe recommendations or something along the way while they were presenting. So we have just 3 minutes to take that, then I'll give some announcements and we close. Any questions, contributions to our presenters? Gefas, Nanim, Shola, Frances, anybody? Even if it's to say well done to them.
Okay, I can go first.
Okay.
All right. So I don't know whether it's still morning where you guys are, but where I am, it is afternoon now. So good afternoon, everybody. My input on today's session, it has been productive. I think we've learned a lot about the presentations, but I think we've also been able to acknowledge that the initial 5 minutes allocated is not enough for our presentations. I like what Bridget has said about sharing a template that can then give us an outline of what to present when it comes to these presentations, because if we are talking about all the deliverables that we discussed across the fellowship, I think there are about 10 deliverables if you look at the worksheet and you feel it well. And that implies that if you are to account for each deliverable comprehensively, give someone, let me say, a baseline understanding of what your project is about, you need a bit more time than what had been allocated initially. So I think I'm just happy that that has been cleared up. And I think I also congratulate the presenters. They've done a wonderful job on what they've presented so far. So looking forward to next week's presentations and maybe get a chance to critique other people's presentations as well as we provide input again. But overall, the fellowship has been great.
Thank you. Thank you so much. Any other contributions? So as we take that, I'll just take the announcement in parallel. So we'll be having presentations on Friday and on Saturday next week so that we can accommodate our fellows' availability. Also, we'll start spotlighting you. If you're interested in us spotlighting, so we're going to take your consent to spotlight you as a fellow and also your projects that you've worked on. We'll be sharing a link where you can upload your professional picture, your bio, and your any other thing. I think some details we'll share with you. So if you consent to us posting your participation in the fellowship, please do upload those details to the folder and would, of course, share that across all our media platforms. Yeah. So we're spotlighting on LinkedIn, Instagram, and on our website. So those are the 3 channels where we'll be spotlighting our fellows. If you consent to this, do upload your details when we send the link. So Friday, Saturday, we'll still be taking presentations, and we most likely might have the guest appearance. So we apologize that hasn't happened. Most of the guests were very busy. Most of them work with international organizations, so they had field work, WHO, Africa CDC with the Ebola thing, so they were very busy and on the field. We did make those efforts, but availability has not been a good one on our side. But hopefully, we're able to confirm one person for Saturday, so we can also hear from people on the field who have more experience using M&E in their digital health implementation. Somebody external who can also shed light on this area. So hopefully we're able to get that done. And with that, on Saturday next week, we'll officially close the fellowship. Thank you all so much. And your certificates would be available latest Tuesday of the following week. Thank you all. We hope this has been a good experience across board. Looking forward to your presentations next Friday and Saturday. Do take the rest of the week to complete your work. The YouTube playlist is updated. You can catch up on all sessions. Reach out to your mentors. They will still give you an opportunity to have the office hours to ask questions and guidance. So see you all next Friday. Bye.
Thank you. Bye-bye.
Thank you. Bye.
Thank you. Bye-bye.
Thank